Hello everyone, my name is Leah and I'm going to present to you the study entitled Impact of Hysterectomy on Sexual Function in Women with Cervical Cancer. We are from the Federal University of Ceará and my attendance here was funded by this institution. So, as we know, in Brazil, cervical cancer is the third most frequent cancer and the fourth leading cause of death for women. We also know that one of the ways to manage the early stages of cervical cancer is usually performing surgery. One of the surgical techniques that can be done is radical hysterectomy. We also know that radical hysterectomy can lead to a major morbidity for sexual function. Unfortunately, the long-term prevalence of symptoms and the extent of morbidity associated with hysterectomy have not been well established in the literature. In light of this problem, we asked ourselves, what is the effect of hysterectomy for cervical cancer on sexual function? To answer this question, we performed a systematic review of the literature in September of 2019. The search was conducted by 2 authors in independent ways and 6 databases and in the list of references. There were no limits regarding the language or the period of publication of the manuscripts. To help establishing our inclusion criteria, we based them on the PICOS framework, which means population, intervention, comparison, outcomes, and study designs. For the population, we wanted the studies that included women aged between 18 and 65 years old. For the intervention, we wanted the studies that included women that had hysterectomy with or without radiotherapy or chemotherapy for cervical cancer. As for the comparison, we wanted to compare with hysterectomy for benign conditions. As for the outcomes, we define the prevalence or occurrence of sexual symptoms. And for the study designs, we included observational and experimental studies. Our primary outcomes were the decreased vaginal lubrication, dyspareunia, superficial or deep, and the difficulty in having orgasms. To assess the risk of bias, we used the Joanna Briggs Institute Critical Appraisal Checklist for studies reporting prevalence data. We performed a qualitative synthesis of the studies that were included in our review. And meta-analysis was not possible due to the heterogeneity in the methods. As a result, we included 7 articles in our final sample that investigated female sexual dysfunctions. For our primary outcome, dyspareunia, we observed that this was related to simple abdominal hysterectomy, and the rates in our sample varied between 6.6% and 16.5%. We also observed that dyspareunia was related to laparoscopic radical hysterectomy, and the rates varied between 16 and 17%. As for the simple vaginal hysterectomy, the occurrence of dyspareunia varied between 11.3% and 24.4%. As for difficulty in having orgasms, this was observed in women that had laparoscopic radical hysterectomy, and the rates varied between 13 and 14%. And as for the decreased vaginal lubrication, this was observed in abdominal radical hysterectomy, and the rates were higher than the others. It varied between 26.2% and 27.8%. These results are significant and important to investigate since in Brazil each year about 300,000 women receive an indication for hysterectomy. These patients may present changes in self-image and depressive symptoms due to conceptions about the uterus that are closely linked to the woman's sexuality. And in addition to the emotional changes, hysterectomy can also lead to anatomical changes such as the size and diameter of the vagina that can lead to dyspareunia and the reduction of circulating hormone levels, which can also decrease sexual desire and decrease lubrication, and also lead to the difficulty in having orgasms. In conclusion, we know that sexual dysfunctions in hysterectomized women are frequent events, and we also like to point out that it's essential to promote women's health undergoing treatment for cervical cancer with a consequent improvement in quality of life. Thank you so much.